Yesterday we have seen subjective assessment and then observation. We have seen, right? Subjective part and little bit observation part. In that palpation, mild observation, palpation, and mild evaluation. We have seen. Now I'm entering into, and of course, I think we have seen higher mental function also. Now I'm entering into cranial nerve assessment. I told you we are going step by step. This is about higher center. So higher mental function, right? Then next level is here we have what is this? Brainstem. After that we have spinal cord. So first we have assessed this. In that a pending part is motor. You will see that. Again, the small pending part is sensory. We will see that. But anyway, roughly we have seen the higher mental function. Then brainstem. Now we are going to see. Next we will see about spinal cord. So what we are going to see about brainstem, the point is in the brainstem only we have cranial nerve nucleus. 10 cranial nerve nucleus are present in brainstem. You know that? Only 2 cranial nerves are out of brainstem. That is, first one, what is that?
Olfactory.
Olfactory. Second one, optic. Because there is no cranial nerve nucleus which is present inside the brainstem for those 2 nerves. So these 2 nerves are so special. Okay, you will understand when I'm telling you about the awakening of consciousness. At the time, you'll understand. But anyway, now you understand. These 2 nerves are not having nucleus within the brainstem. All the other nerves are having nucleus within the brainstem, maybe in pons or middle or midbrain, but anyway, within the brainstem we are having. So we have to understand what is happening in the brainstem. This is the next part. So for that, we are going to assess each and every cranial nerve separately. So it will give total idea what is happening in the brainstem, which part is affected, which part is not affected. Like that, it will give some clue. For example, some parts are affected. That means some cranial nerves are affected. That means that particular region is affected. These cranial nerves are fine. So this region is not affected. Like that, we can understand. So we can understand which part the lesion is actually happening. Fine. Well, first nerve, what is that? Olfactory nerve. What is the function of that nerve? Smell. Okay. So now we are going to check and assess the cranial nerve first. That is olfactory nerve. Okay. For this, we have to make the patient comfortably sitting in a fine place. Okay. The rooms are closed. It is so dark. Should be fine. Ventilated. Full aeration should be there. He should be completely in a pleasant situation. He should be completely in a pleasant situation and full aromatic. Fine? No. Because we are going to check olfactory, smell. Suppose imagine these entire area is filled up with some fine aura or aromatic smells. How it will be. And we are going to check what the result will be. The room should be completely sterile. It should not be having any smell at all. Right? It should be so clean and clear. Now I'm going to introduce some object towards his nose. First point, you should ask the patient to close one nostril. Close one nostril. And we are going to introduce one fine object. Okay. Close to the nose at about 10 centimeter. Okay. It should be like this. And we should ask the patient to smell it. And he will feel it. The same way. Okay. Take your hands. To the opposite side. Yes. This is close. You should ask the patient to close the opposite nostril and introduce the same object to the opposite side at the 10 centimeter distance. And we have to compare both the sides. What did you feel? So how did you feel? Do you feel the smell? Like that we have to ask. Otherwise, the patient itself will tell. The second choice is we can close the eyes, keep the patient's nostrils closed one side. At a distance of 10 centimeter, we can place the particular object like this, close the eyes with cloth or hands. Now ask him to tell what is the smell. And he can say, okay, both are right only, but at a particular distance. But we should not give any clue. Like for example, I'm going to introduce a lemon to you and you have to say which smell it is. Where it will be working? No, that's rubbish, right? So we cannot say about that. One. The smell which we are introducing to him, it should be so nice and aromatic, fine, of course, but it should not be irritant. Like yesterday, I told you, fine Axe perfume, Axe deodorant, Axe scent, spraying in front of his nose. How do you feel? No. Maybe he may die because he may be having head injury. It may cause hyper irritation that may stimulate the CS of overflow or rise in BP. It should not happen. Okay? So you should avoid them. You should go for low irritant, hypo irritant smells, mild smells like cardamom, cardamom, mild mint, or coffee bean, or directly coffee, right? Coffee means what? You can ask him to, you can keep it like this and smell at a distance of 10 centimeter. You have to keep it like this. What is this? Can you smell it? What is this? You can ask. Okay. And cardamom, um, lemon is a good example. Mild irritant, but it is smelling good. Okay. Then you can go for soap. Soap means not toilet soap. Okay. People who are taking bath daily will understand what is toilet soap. But I'm telling you about the washing soap, cloth washing soap. That will be having very mild smell. You can have it in your hand, finger, like this little, and place it near the nostrils of the patient at 10 centimeter distance. You can ask him what is the smell, or else very mild shampoo, like chick shampoo or something. Just a pinch. Take it like this, pipe it like this, and keep it here. Okay, close one nostril, keep it at a distance of 10 centimeter, and ask the patient what do you feel. Okay, and the same way to the opposite side.